rate of increase in the 15 to 19-year-old range. This is especially noticeable over the past 2 weeks. In fact, we're seeing almost 20 new cases per day in the 15 to 19-year-old age group. This is a chart that's been produced by our County Department of Health, which again shows a very dramatic increase beginning in July until the end of August in the 15 to 19-year-old age group. And this is based on data that has been collected by our contact tracers and our case investigators, not based on any single event or any single gathering. Rather, it's just our teenagers who are out and about. And teens do what teens do. They hang out with friends, they go to events, sometimes they go to school-related activities, normal activities, but during an extraordinary time. And this jump is not unexpected, but it's worrisome. We know that our 15 to 19-year-old age group may not become as sick when they contract the coronavirus, but we know that they can also take it home and spread it to others who have a higher risk of becoming seriously ill. And that's why we emphasize again and again the importance of social distancing. And this is more challenging as people gather together in groups. Remember, masks are required apparel. Please wear one. Please be diligent. And if you have symptoms, no matter how mild, please stay home. It may not seem like anything, but if you have the virus and you go out shopping with someone or you go over to visit someone at their house, anytime you're together, you're exposing others to the virus as well. And this is especially important as some kids are starting back to school in a classroom setting or gathering at school-related events. The virus spreads easily and it spreads fast. So please take care of yourself, and in doing so, you're also taking care of others. This morning I wanted to give you an update also on the participatory budget process to distribute $7 million of CARES Act funding to expand access to health care in some of our underserved areas in St. Louis County. We asked residents in 18 zip codes, 17 of them in North County, one in southeast St. Louis County, on how they would like to see $7 million of CARES Act funding spent to expand access to health care. The targeted areas were chosen based on census data, unemployment rate, the rate of uninsured, and the impact of COVID-19 on this region of our community. The residents in these areas identified 5 areas where they would like to see expanded access. This includes increased access to testing, especially where people gather in groups, like churches or schools, or even increased access to homebound patients. They identified PPE and supplies, primary and preventative care such as dental care and vision care, access to mental health services, and emergency health care needs such as help with copays, prescription drugs, or even improved access to technology to participate in telehealth services. We had 38 applications to provide these services, and so far 13 organizations have received a notice of award. We've awarded $2.2 million towards this effort so far. We'll have more announcements in the future as we continue to process applications. My staff, along with the staff of the Department of Public Health, will continue to work with residents to identify the greatest needs in our community, and will continue to work to get our resources to the areas of our community who need it the most, especially during these very challenging times. Thank you, and be glad to answer any questions.
Sam, I do have one question from St. Louis Public Radio regarding the Justice Services employees.
Yes.
We submitted a letter to the County Council last night mentioning their concerns about Director Banasco's leadership. The question is, what is your response to the letter, and will your administration be taking any action to respond to this letter?
Okay, so there's a question about Justice Services and the letter that the County Council received last night regarding the concerns of the Director of Justice Services. And I just first want to recognize that Justice Services is a very difficult place to work. People who are in our custody, in our county jail, are very sick. They have serious issues, many of them have serious issues with substance abuse or mental health challenges, and we recognize that this is a difficult place. We've had a lot of struggles there over the past 3 or 4 years, and some of them have been very high profile. The director is brought in to help change the direction, to improve the training and cooperation between our corrections officers and our nurses, and he's done that. We're going to take these concerns very seriously. Anytime people are working in a difficult environment, anytime there is change, there's going to be a lot of tension, and we're sensitive to that, and we're going to review these concerns and see what we can learn from them and make sure that the corrections officers who are implementing some of these changes have the proper training to take care of a very difficult population and that their concerns are heard. Anything else, Doug?
That is all I have.
Okay, thank you.